was sort of during 2010 that I started having problems with the knee, and it got to a point where clearly I wasn't going to work through it. We did the stem cell treatments, and I was up in upstate New York, and for 4 days in a row I spent about an hour and a half cross-country skiing with no trouble at all. So I'm sold.
Wow, sounds awesome. Well, it sounds like something out of the future, all right, or a futuristic novel. Harvesting stem cells out of your own body to heal joints and, of course, reduce pain.
Well, Dr. Mayo Friedlis of Stem Cell Arts is here to tell us more about this innovative procedure. First, welcome to the show.
Thank you. Nice to be here.
Now, first, tell us, what are stem cell and platelet therapies, and how can they help heal the body?
Well, you know, I'm a pain management physician. I've been treating pain my whole career. And these are new techniques that can help treat pain in a very natural way because they use your own body's mechanisms for healing pain and actually fixing itself. So platelets come from your bloodstream and stem cells come from your bone marrow. And these are cells that naturally heal us all the time. So all we're doing is getting them, concentrating them, and then putting them at the site of the injury, which can really help things heal. So not just treat pain, but actually help it heal.
Oh, what about good old-fashioned steroids, huh?
Well, steroids are great for a lot of things, and you know, a lot of people get one shot of cortisone and they're done. But in other cases, you know, they're really just covering up pain. They're not doing anything to change the course of the problem, and they're not fixing anything. The difference is we can actually regenerate tissue and repair the injury.
Well, how do you know if this treatment is best for you? I know a lot of people, they just think, I have to have surgery, I have this horrible knee or hip pain. But this man, we saw him in the clip, he's cross-country skiing.
You know, surgery has been the first line of treatment for many, many years, but more and more we're finding that, you know, the natural processes that occur in your own body can help you heal. And so we're able to harness those and actually put them in a knee, put stem cells and platelets in there. And this is a really super process that we use. It's called the Regenix protocol, and it has a lot of research behind it. And we put the stem cells in the knee, and they can actually make that knee feel better. 4 years out, the average person who receives a treatment on their arthritic knee is doing 65% to 70% better.
Wow.
That's brilliant.
Those are pretty good odds for a disease that only gets worse, worse, worse. So
why isn't anybody telling me I have stem cells in my body? Usually there's a controversial stem cell thing with the babies and things like that. Does this have anything to do with that?
These are called mesenchymal stem cells. They come from your bone marrow. They're not embryonic stem cells. They're not controversial at all. They can grow 5 different things: ligaments, tendons, muscles, bone, and cartilage.
Now, once you get the procedure, is there a length of time that passes where you may need to get it again?
You know, we don't know that yet. We've only followed it for 4 years, and so far it's holding. I don't know that it will be forever. It's not rebuilding your joint and giving you a 25-year-old joint.
Okay.
We wish it would, but it's not. We're not there yet. But it's making the joint feel good. And the person is functioning better, and so far that's holding. So
how long have you been doing this? It's a group of doctors, right?
Yeah, myself, Dr. Wagner, Dr. Dade at Stem Cell Arts, and I've been doing this over 10 years, stem cells.
Wow.
And it's been the most exciting thing and gratifying thing I've done, because it takes people and changes their life. And you know, you get people who are active, and nowadays everybody's wants to be active, and they want to stay active as they go through the aging process. And you know, you get an injury and it puts you in a little box, and you're not yourself, and you're not doing your thing, and this gives them their life back. So, and with no surgery and no downtime. And
that's the big thing.
Yeah.
But you know, speaking of aging, I know that may be your target demographic, but are there athletes or other people who use a lot of wear and tear type activities on their body that this would be good for?
Oh yeah, we treat lots of athletes with rotator cuff problems, tennis players, golfers with elbow problems. We treat a lot of spine, people with pinched nerves and disc problems. These treatments are useful for that too. So our spectrum of patients is right across the board.
Very interesting. Where can people find out more information if they want to call you, maybe get a consultation in your office?
Well, we have 2 offices in Tysons Corner, Virginia, and in Chevy Chase, Maryland. And our website is stemcellarts.com. And there's lots of information there on the research and you know what protocols we use. So it's a lot of information on there. Love to see people and try and help them out.
I bet they love to see you too. Good. Thank you, doctor. Appreciate you coming around.
You're welcome.
I'm not sure if this is one of your patients, but Santa Claus is coming to town. He'll be at the Gaylords Nationals Christmas on the Potomac, and we want to give you 4 tickets to see the classic Christmas scenes hand-carved in colorful ice.